As we go to air tonight, New York is a city under siege from an invisible enemy. The Big Apple is in the grip of a devastating COVID-19 outbreak, with more infected and more dying. Our US correspondent Alexis Daish just filed this report from Ground Zero.
If ever there was a symbol of what this pandemic has done to the world, this is it. In the heart of New York City, one of the world's most famous tourist destinations, in a landmark we all know so well, Central Park, we find a field hospital. The volunteers that built this are from a global relief agency that specialises in helping victims of war, of poverty and natural disasters. We've spoken to the nurses here and they've told us amazing stories of having been in Liberia to fight the Ebola outbreak, also going to Mosul in Iraq and going more recently to the Bahamas during Hurricane Dorian. They all tell us it is just surreal to be here in Central Park, New York, treating COVID-19 patients. In a matter of about 3 days, they built this hospital from the grass up. They are now open and treating victims of COVID-19, and they only treat victims of COVID-19, making this field hospital unique compared to some of the temporary hospitals here in New York. As a journalist back home in Australia, I was a crime reporter, and you would often go to car crashes or police chases, and you would speak to witnesses who would often describe the aftermath as a war zone. Well, having been here and seen this is a completely different level. This is a war zone. This is a medical war zone.
We will bring patients, this is not the ICU ward, so these will be patients who are very ill, but are not intensive care unit ill. And they will receive the best possible care.
What are the prospects? If people end up here, are you prepared for the fact that some may not survive?
Unfortunately, that's always a reality that we do have to face in these circumstances.
We've been covering this pandemic here for 3 weeks now, and what we're witnessing is effectively two battles unfolding simultaneously. There's the fight against the virus itself, which is simply the reality we find ourselves in. And then there's the battle against the strong emotions this virus has created. The fear about us or our loved ones getting infected, the anxiety about when this will end, the isolation as our normal routines have been brought to a screeching halt. Everyone is fighting their own unique demons. The Governor of New York said it well when he said that the fear is wholly disconnected from the reality. And of course he's right. Our emotions about this pandemic ultimately have no bearing on what this disease does and what happens next. But I think we simply can't ignore those emotions, because in this war, the soldiers on the front line may be the nurses and doctors, but we are all the civilians with the power to stop its spread. The President himself said this is an invisible enemy, and that power to stop the spread while keeping our emotions in check is key. It's what the doctors are calling mitigation. Staying home and staying away from other people. We have the best doctors, the best mathematicians and epidemiologists in the world looking at what's happened in places like Italy and China and creating models that other parts of the world can look to as a reference point to predict what's going to happen next. That's what the coronavirus task force at the White House has been doing, and then advising the President accordingly in terms of where this goes next and what needs to be done. When you look at the number of cases in this state, New York State, compared with other parts of the country and the trajectory the disease has taken here, it is quite frankly terrifying. The situation here is so much worse than the rest of the country that New York in itself has provided a model for other states and could serve theoretically as a model even for Australia. But there's a catch. These models and projections for the future that they provide are only as good as the assumptions you put into them. For example, here in the US, the White House presented a model to Americans this week, and it went like this. With no intervention, in other words, no social distancing, the potential number of deaths here would be between 1.5 and 2.2 million people. But with intervention, in other words, implementing all the social distancing and closing businesses, the potential number of deaths comes down to between 100,000 and 240,000 people. That model and prediction is based on the assumption that everyone is following those intervention measures with great discipline. If Americans stray from the guidelines and don't do what they're being told, that's when things get unstuck and these models are useless. It's an incredible example of science and numbers interacting with our own behaviour and society in order to have a desired effect. And I think it's pretty safe to say we all have the same desired effect in mind. And while we have the same underlying question for experts, all of us, When will this end? The answer actually lies in all of our own actions. Stop asking the experts that. Start looking inward at what you're doing to mitigate the disease, because that's what will bring this to an end sooner rather than later. New York's Governor Cuomo has been talking every day here about the apex, the peak of this disease, and when it will hit the city the worst. That too is based on different models he's looking at, and they change from day to day. But the estimated peak of COVID-19 victims in New York is now expected anywhere from the next 7 to 30 days. So potentially we're looking at another month of this pandemic getting worse here. And as this city comes closer to that peak time, well, the soldiers on the front line, these volunteers, the nurses, the doctors, well, they're all preparing as best they possibly can.
Because the disease is endemic, and the reason I'm wearing this mask right now and you have one on your arm is because you want to maintain distance. And so even on the safe zone, our staff will still wear masks.
So if you find yourself complaining about being at home or being bored or not being able to go to work, spare a thought for those nurses and doctors on the front line. They are already emotionally and physically exhausted, and the worst is yet to come. And unlike other things like a natural disaster where you know that there will come a point at which we can rebuild, there is no light at the end of the tunnel with this one. The reality is no one really knows when this will end. I think the New York Governor Cuomo, put it really well when he said that the sheer duration of this pandemic is debilitating, exhausting, and depressing. So we must keep our own emotions in perspective here and think of the heroes who are fighting this pandemic, the nurses and the doctors who are actually saving lives. And bear in mind as well, they are saving lives with medical supplies that are right now almost gone here in the US. The federal officials here say that the national stockpile of protective gear like gloves, masks and gowns is almost all gone. And so the states have found themselves in this position where they are essentially competing with one another to try and get their hands on what's left. It's been described here as like bidding on eBay. So let that be a model for what could now happen in Australia. The disease itself is the battle, the reality of the battle that we face. Then there is another battle, which is the fear and the anxiety that we attach to it. Don't be afraid, try not to be anxious, just do your bit to try and make these mathematical models work and make them useful for our governments and authorities that are advising us to try and make this pandemic pass as soon as possible.
Yeah, such important advice. Alexis Daish there in New York.